Good afternoon, everyone, and thank you so much for joining our webinar today, Pivoting Services and Innovating During the Pandemic. This webinar is brought to you by the Ontario Nonprofit Network. My name is Melanie, and I am the Communications and Network Engagement Manager here at ONN. If you're new to ONN, we're the provincial network for the 58,000 nonprofits and charities operating in Ontario. We focus on public policy, advocacy, and services that strengthen our nonprofit sector. If you're already a member at ONN, welcome back and thank you so much for your support. Our advocacy work would not be possible without your support. Now, while we're getting warmed up, I just have one last poll for you guys to fill out, and I would love to know what you're interested in learning during the webinar. So are you interested in learning about how organizations have changed their supplier approaches to best meet the needs of their organizations and communities during the pandemic? Are you hoping to learn procurement strategies that have helped nonprofits continue operating during these unique times? Are you hoping to learn more about partnership development and how you develop these partnerships with local suppliers and how we can do this efficiently? Or lastly, are you interested in joining our live question and answer session where you can ask specific questions related to your own nonprofit and organization? Now, while you're filling out this poll, I'm just going to go through a couple housekeeping notes. So if you experience any technical difficulties during the webinar, such as a visual lag, we recommend that you close your web browser and reopen it. If you're still experiencing any problems, you can reach out to us through the question box. If you have any questions for our webinar speakers today, you can also type them into the question box, and we'll answer as many questions as possible during our question and answer session at the end of the webinar. To answer our most common question, you will receive an email with the recording and the slide deck within 1 week. So I'll just leave that open for one more quick moment. Great, so it seems like there's a wide mix in what people are looking forward to learning. And we're going to be covering all these topics today. But if there's something that we're not able to get to, don't worry, we'll send some additional resources in our follow-up email as well. Perfect, so Dave, I'll just get you to go back. Thank you so much. And before we get into the conversation, I would like to acknowledge the land that we're working on. Here at ONN and also myself, we're working on the traditional lands of the Huron-Wendat, Haudenosaunee, and the Mississaugas of the Credit. This territory is a part of the Dish with One Spoon Wampum Belt and the Upper Canada Treaties. At ONN, we believe that as nonprofits, we must take seriously our role in responding to the Truth and Reconciliation Commission's call to action. As settlers, we are grateful for the opportunity to live and work on this territory. And as individuals, we all have an obligation to learn from Indigenous communities about collective ownership and sustainable economic and environmental systems that are respectful of the land and the water which we all depend on. Today we're going to be hearing from two great speakers, and I would like to introduce them first, and then they'll be taking over. We're going to be hearing from David Rourke and Carrie Lewis. David is the co-founder of Roundtable Procurement Services, an organization focused on helping nonprofits manage their purchasing to better deliver on their mission. He has over 20 years of experience in procurement, including teaching, consulting, and management roles with government, for-profit, and nonprofit organizations of all sizes. Through RTPS, David co-founded the Canadian YMCA and our own Ontario Nonprofit Network purchasing programs, which are projects dedicated to supporting improved purchasing among networks of nonprofits. David has degrees in engineering and business, and he lives with his family just outside of Hamilton. Carrie, thank you so much as well for joining us today. Carrie is a General Manager of Child and Family Development at the YMCA of Greater Toronto. With 30 years of experience at the YMCA, Carrie has held several roles in licensed childcare, day camping, outdoor education, community recreation, and fundraising. Her current role is in program quality and compliance, and she's responsible for a team that conducts audits of 300 licensed childcare centers and for developing a training plan for all supervisors and staff that supports them in their role of maintaining compliance with all relevant regulations. Carrie has a degree in early childhood education, a diploma in recreation, and is a green belt in Lean Six Sigma continuous improvement. Thank you so much, you two, for joining us today. I'll hand it over to you now.
Thanks, Melanie. Thank you very much for the warm introduction, and thanks for having us today. I really appreciate everyone's time. We know it is crazy times, and there are long to-do lists, so we appreciate you taking some time to talk. What are we calling this? Pivoting services and innovating during pandemic. Now, I want to clarify for everyone that we will be talking about changes and adapting to the changes that we've all lived through over the last few months, but we are certainly going to have a purchasing, supplier management, supply chain focus. So hopefully that's in line with what everyone's expecting today. I also want to thank my good friend Carrie Lewis for coming along on this ride with us today, and all the ups and downs we've had in dealing with this pandemic over the last several months.
Thanks, David.
And what a ride it's been, isn't it? The roller coaster is about the best image we could think of to talk about, you know, just as we reflect back, and we're still living in it, of course, but boy, I've lost track of just how many months it was. I suppose it really kicked into gear in March, and we've lived through it ever since. Just the changes that we've all had to experience, the unprecedented just seems to have been the word of choice that we've all been using to try to just survive, to manage, to continue to deliver on our objectives and on the important missions that we exist to. That's, you know, why we're there, to help people, and it's just been so difficult to do over the last few months. What we've seen from a procurement side of things, because procurement was certainly impacted as well, but in trying to, one of the challenges, or some of the challenges we've been facing, is just how wide of a range the changes have caused the impacts on the nonprofits that we work with. I mean, we saw everything from organizations being totally shut down, and perhaps maybe locations or different sites shut down. Certainly offices, people are certainly not going into offices like they were before. So that was on one end of the spectrum, a reduction of operations, all the way through to the other end of the spectrum, where some of our organizations that we work with were trying to stay open, and in fact saw ramped up programming, locations and operations that were busier than ever. So one of the examples we'll talk a lot about today, with Carrie here as a co-speaker, is the YMCA, and so they're one of our key partners that we work with. And you know, many are aware that the health and fitness industry has been hit hard by this. The YMCA health and fitness centers are at the end of the spectrum, that, you know, constantly having to either shut down or drive into low operation mode. On the other end of the spectrum, programs related to housing or dealing with the community, vulnerable youth, all were very much open and dealing with conditions like never before. Somewhere in the middle, and I'll defer to Carrie on this, but somewhere in the middle were the YMCA's childcare operations that we were trying to support. We went from everywhere from, are we closed? Are we open? Are we open just for emergency purposes? So I think we certainly saw the whole spectrum. And with that, I'll turn it over to Carrie to talk about the experience at YMCA Child and Family Development. Thanks, Carrie.
Thank you, David. Good afternoon, everyone. I'm very grateful to be here today to share a little bit about the YMCA's experience over the last 9 months. I'll just give you a little bit of background context so you can see where we started 9 months ago. So the YMCA of the Greater Toronto Area is actually a leader in providing licensed childcare, and we have a network provincially and across the country that share the same curriculum, which has been developed by the YMCA. So we cover the area of Dufferin County, a big chunk of Halton, Peel, York, Durham, and Toronto, just to give you a scope of our YMCA. And as we've mentioned before, my department is 300 licensed childcare locations for children. There are various age groups depending on the center, but basically from birth to 12 years of age. Majority of our locations are in public schools and Catholic schools. We also offer family drop-in programs through our early on centers, supervised access for families who have custodial arrangements, school nutrition programs, the Ontario After School program, who many of my recreation colleagues would be familiar with, and other family support programs. So in March, we were serving 21,000 children and their families in our licensed programs. And we had about 3,200 staff on payroll. So the week before March break, we were all working heavily through the implications of COVID for policy and process and trying to understand how to keep people safe and healthy. And one of the biggest challenges that we were working through was this new idea of self-isolation after you've traveled. And, you know, there was some real challenges about how to supportively and kindly speak to our families about staying home after they traveled. And there was a little bit of tattletaling from other families if they knew somebody traveled. So we were trying to navigate all these very, very sensitive topics in a way that did not point to one particular group of people as causing the problem of the pandemic. Near the end of the week, we started to hear rumblings from many of the school boards. So we actually have relationships with 14 school boards across those regions. And there was a talk of a 3-week March break closure to try to stop the pandemic. And so there was so much uncertainty because really it was rumor, and you know, the closer you had the contact, the more information you had, but really nothing was on paper. And it came down to March 13th, which I will never forget in my entire life because it was my birthday and I was very, very sick. In fact, I think I had a mild case of COVID. Basically, the emails started pouring in saying, we're going to close and you can't get access to your centers during this period. So that meant of the 300, we were only going to be able to operate 31 childcare centers for 3 weeks. That was an unbelievable slap for us. We just could not wrap our heads around that. It was very difficult. So as the day progressed on March 13th, we had an incident where a placement student was in one of those 31 centers who had tested positive, and it became abundantly clear that we had to close the entire childcare operation down, that we just couldn't take the risk. And one by one, all our programs at the YMCA, the decisions were made to close. And that's what happened as the day progressed. And we spent the afternoon coming up with communications to inform all our members and partners. The following week, we laid off most of our staff in the childcare department, and we left a skeleton staff of supervisors so that they could communicate with families and support our staff as they applied for unemployment insurance, and administrative staff, because we now had to amend 21,000 accounts so that people were not charged fees for services that they were not going to be received. So I learned a new skill of amending accounts, which I wasn't expecting to learn. As you all will remember, it was a very distressing, ambiguous, and overwhelming time for all of us. And to think that the YMCA was closing at a time when people needed us the most was a very, very difficult and emotional decision. I remember just sitting the next couple of days after speaking to my team and telling them that they were being laid off, just being quiet and wondering what will happen next. Will this end in the 3 weeks? And just that thought of there's no programs, which means there's no revenue, which means there's no jobs, and there's no end in sight. It was quite overwhelming. Okay, David, I think we'll flip.
Okay.
So here's the pivot part of the presentation. almost simultaneously as we were working in Peel region, as we were closing our programs and understanding what type of funding was still available to us, they were also asking us to think about opening childcare centers for essential service workers who lived and worked in Peel region. And that, in fact, is what we ended up doing. We worked with the region and the local public health unit, and we came up with some of the first sets of guidelines based on what had been pumped out quite quickly by the Ministry of Health on how to deliver safe and healthy childcare to children and their families. Peel held the role of setting up their website so that people could apply for the programs. They decided whether they were eligible, and then they passed those parents on to us. So the interesting thing is, of the 300 families we served, none of them were our current families. These were completely new relationships. And by the time it was over, many of those people left their previous providers and ended up staying with us because of the great relationships that we built. So you have to imagine it was very low numbers. It would be 1 or 2 staff in a room of children, of maybe 10 children, 8 to 10 children. And so the opportunity for the kids, although uncertain at first, they just loved it because they got so much attention, and it ended up being a really, really great experience after we got over the initial anxiety about illness. We ended up with 10 program locations in Peel, 2 in Dufferin and 2 in Durham. And the first one opened April 6th. And we ended up running those right until the week before, 2 weeks before summer started. And that's when we opened half of our programs. We opened about 150 locations. And then in September, we opened the other half. Other good news things that happened was the CERB. So after crashing, everybody in Ontario crashing the unemployment insurance, or the employment insurance website, of course, we were able to call our staff back at 90% of their salaries. So CERB covered approximately 75%, and the YMCA was able to cover the rest. So that was a really good news story. And we ended up actually taking off a big project in our brand new 5-year strategic plan, and that was to expand our digital technology and communications and programming out into the world, and we did it overnight. So what was a 5-year plan just happened quickly. We quickly became familiar with Microsoft Teams and Zoom for training our staff. So staff are back, but they weren't all in the centers. We did training with them. All our staff learned how to use Google Classrooms. They provided programming for our families and communicated with them on a weekly basis. So that was their role during those few months if they weren't working in one of the emergency centers. And we also formed overnight a Facebook committee from all our program areas, and they all worked together and set up a program of daily online programming, and that continues. So I encourage you to go to the YMCA GTA website and take part in some of our online fitness programs. One of the key relationships, in fact, it was the key relationship for childcare, was our link to David and his team, in who we call the procurement team. We already had a great relationship with procurement, but this experience absolutely solidified the importance of having that connection. If not for David and his team, we just would have been overwhelmed with having to contact vendors to inform them of our closures, negotiating whether we could stop paying for particular services, and of course, the sourcing of all the personal protective equipment, which David is going to talk about. And because of childcare, we're very heavy with needing those types of materials. Yeah. So basically, we set up a system where David had a central inventory, and we had to get those out first to the emergency centers and then out to all the 150 first centers in July. So we set up hubs, and David and his team, mostly David, would go to one of the health and fitness centers where we had the inventory. We would send in our request, he'd fill up the truck, and he would spend the afternoon driving around to all of these hubs across the GTA. The good news is David got to turn in his keys on September 15th, and with that, I'll turn it back to him.
Thanks, Carrie. Yeah, fun times. And I will get into that a little bit more, but it was a really all hands on deck situation, as I'm sure it was for so many of you. But you know, here we are having someone like Carrie talk about all the challenges faced with the network of childcare centers you can imagine. And thanks, Carrie, for that context, because I think so many people can relate, if not to scale, then at least to the challenges that were faced if you had to stay open and continue delivering programming. But you know, it's so unfortunate that one of the top challenges that Carrie and her team had to face was in the area of procurement. And that was, you know, for years, as Melanie said off the top, I've been doing this a long time, and for so many years, it was very difficult to get boards and executives at nonprofits to be thinking about procurement, supply chain, purchasing. You know, to get that on the board agenda was difficult. Well, you know what they say: be careful what you wish for, because the COVID situation has certainly brought supply chain management, procurement, supplier management to front and center, into the spotlight, even as unwelcome as it was. It's dominated everything from our kitchen table conversations to mainstream news and media. That this suddenly got thrust into the center of everyone's attention as we were faced with all these challenges that we'll discuss today. And we're discussing them today because we're going to talk about some of the strategies that we are able to put in place to address them, and to make sure that if nothing else good comes out of this whole pandemic situation, that this is one of the, hopefully, you know, long list of things that we can learn to whether it's preparing for a regular course of business or preparing for whatever the next crisis is that comes along. So in the spirit of learning, we're going to keep trying to revisit some of the pain over the last few months. Carrie mentioned it. Really, so many of the challenges were based on the shifting environment, all the changes. You know, are we open? Are we closed? Are we changing the scale of our operations? So, from a supply chain perspective, what that translated into was just uncertainty with our supplier partners. I think communication was so key with all of our stakeholder groups. It was easy to forget about the supplier community, but you know, they were really, the suppliers we worked with were really concerned and in many cases confused just about whether services were to continue, frequency was to increase, decrease. In some cases, we were adjusting for a slowdown in operations. In some cases, we were doing the reverse and ramping up. But if deliveries were in place, for example, then we had to communicate new site visit protocols or delivery protocols for coming on site. So the notion of just everything being different and changing and reinforcing the communication element of what we were doing was certainly one challenge. You know, another set of challenges lied in the change of requirements. So not only you know, were we thinking about shutting down, but we were thinking about ramping up, as I said. Well, we know some costs and some things that you use suppliers for, goods and services, they're variable. And as you increase or decrease operations, those requirements go up or down. So having to manage whether it was, you know, something simple like office supplies or cleaning supplies or some of your health and safety supplies, those would actually have increased if you ramped up your operations. And then, as we said, in some cases they decreased, and we had to manage against hitting minimum quantities required from suppliers. So the variable cost was one concern. But frankly, I think we spent more time dealing with the other side of it, which were the fixed costs. And Carrie alluded to it a little bit, that you know, there are some costs that just sit there in the background. We're paying monthly charges for our telecom, we're paying for photocopier leases, we're paying for you know, elevator maintenance contracts, cleaning contracts. certainly if your office or if your program location isn't open there, it's a shame to be, let's face it, it's a shame to be paying those if there's just no need for them. So trying to work with our suppliers to adjust the terms of those payments, to make sure that we minimize the impact as much as possible was a real challenge. And in some cases, we had to enforce outright cancellation. And you'll see on the slide that force majeure clause. I don't know how many people would have come across it in the past, but it exists in most of the contracts we put together. I can honestly say before this year, I'm not sure I ever remember having to even talk about it, never mind enact it. So the force majeure clause, act of God, these pandemic type events allows you to cancel agreements that would otherwise have cost a lot of money as services continued when they weren't required. So again, really unfortunate, but in some cases that was necessary just to help minimize some of the financial impacts. And then, so assuming that your operations were to continue, we found ourselves having to address new requirements that we had never had to address before. Of course, things like cleaning, we had a long history of developing cleaning service contracts, but suddenly cleaning took on a whole new meaning. The specifications for your typical cleaning contract needed to be changed. We were no longer cleaning, we were sanitizing in some cases. So having to address that kind of change was a challenge. Having to find new products. How many of us had ever had to buy plexiglass barriers before? Suddenly everybody's buying them. How many of you had to revisit your insurance policies or your human resources or health and safety protocols, and perhaps you needed to invest in a consultant who specializes in those areas? Suddenly those consultants were busier than ever. We had new pieces of software coming up. Suddenly everyone's got a Zoom account, or they're flipping the switch on their Microsoft Teams and the ability to do that. So in a short amount of time, there was this wave of new requirements, new goods, new services that were required. Definitely a challenge in the procurement world. But how can we not talk about the infamous PPE, again, hitting even mainstream news quite a bit, really being a hot topic for all our government bodies, our regulators, and presumably for most of the people on this call, even if it was just in your personal lives. Suddenly everyone was looking for PPE, and it's thankfully settled a bit back down now, but I'm sure we can all remember March, April, May, when trying to source a mask was difficult. Hand sanitizer was hard to come by. All of it was just was crazy. And not only that, it wasn't just finding it; it was trying to manage against the backdrop of all these changing requirements or emerging specifications, better put, from health officials. Even at a regional level, from within the GTA, we'd find that the PPE requirements, minimum standards, were different, and trying to navigate through that was incredibly frustrating. Even right until, I don't know how many of you saw it, but last week, Health Canada revised their standards for reusable masks, the cloth masks, that now you require a non-woven filter layer in there, which wasn't necessary before. So we know organizations who are sitting on previously compliant reusable masks that are suddenly no longer compliant because of the shifting specifications. And then other challenges we think about, all these new supplies that were required had a bit of a ripple effect downstream. Where not only where do you get them, but how do you manage the inventory of receiving them? I mentioned, just because of how difficult it was to find, things like hand sanitizer was suddenly like gold. I mean, if you didn't secure your stock of things like hand sanitizer, thermometers, masks, then it could disappear very easily. And so Now we're faced with challenges like, okay, how do we manage that inventory? How do we secure it? How do we make sure that we've got enough? You know, in the world of inventory management, often you're thinking about forecasting what your future needs are so that you can purchase against those. But how do you forecast when there's no historical data to even say, you know, at what pace you're going to use these supplies up at? So, you know, things like building building systems to help manage the inventory is or storage or distribution, as Carrie mentioned. You know, if you receive large quantities of this stuff, how do you get it out to the people who need it? Well, in some cases it meant, renting some trucks and driving it around. In other cases, it meant more renegotiation with our suppliers to revisit how goods and services were distributed. And suddenly we're shipping to people's houses because that's where their office location now existed. And of course, on top of all that, the cost side, you know, this new demand for goods and services that we didn't need before meant budgets that didn't exist. You know, for many of you, you're in the middle of your budget year, suddenly this demand on costs that wasn't planned for, having to address that. And one of the ways to try to minimize those costs, you were forced into buying large order quantities. This minimum order quantity we saw go way up. And so even to just get supply meant you had to buy more than even perhaps you needed, certainly more than you wanted to store. Anyway, the challenges were many, as I'm sure many of you experienced, and that was what we were in the heart of. So enough revisiting the challenges. Let's think about what some of the strategies we use to address them. It starts with partnerships. I mean, this is a sector built on partnerships. That's frankly one of the reasons we're all here. Being part of the ONN is about leaning on each other and working with each other. But one of the primary partnership that we leaned on is the ones that we had with people like Carrie and her team and our stakeholders at other clients that we work with. And I'm going to hand it over to Carrie, but before I do, it's just, you know, it's another reminder from a procurement best practice standpoint. I've got to get this in because at the top of the list of what makes someone or somebody or some organization good at procurement or supply chain management is understanding your end users' requirements. If you don't do that well, then nothing else matters. And this was just another reminder that being connected to people like Carrie and her team to make sure that we were as informed as we could be about changing requirements, whether it was government driven or operationally driven, and staying on top of what the subject matter experts were telling us. There's no more important relationship in good procurement than that relationship. And if you don't understand your requirements, then you're already behind the game. So with that, I'm going to hand it back over to Carrie to talk a bit more about the WISE experience.
Thanks, David. So some critical factors that made our program successful during this period are just what David were talking about. Really, the most critical factor was the relationships that we'd already established. So here we are in this environment of ambiguity and changing rules. So, you know, we deal with 6 public health departments. They all get their direction from the Ministry of Health, but somehow every single one of them has a different percentage of alcohol that they need in hand sanitizer, or different timing of when you need to wear a mask, or how often you have to clean toys. So we were wading through all these constantly changing regulations, and to have this solid relationship that we had built up over time in procurement allowed operators to do what they're good at, and then we depended on procurement to do what they were good at. So we already had a strong relationship. The childcare department had links to the procurement team. We met on a monthly basis. We had an annual plan that we were working from. We were very clear on our roles, and procurement understood us. They understood what we needed. And so they always were looking out for us anyways, but when all of this happened, they were so patient and flexible and quick to try to understand all these new requirements, like cloth masks, medical masks, level 1, 2, 3, ASMA approved. Like, what is all that stuff? And some days David and I still have conversations and try to weigh some of that even now, but it took a lot of time and back and forth for us to figure out, should I be buying this particular PPE that a supplier is offering to me? Is that going to meet the standards? And David's leadership to be able to help us set up that inventory system was very, very valuable. So basically we went with from an on-demand system of a supplier. So imagine a big supplier, they set up a portal, a website for us. One of our supervisors of a childcare logs in and they order what they need. Well, we couldn't work that way anymore because we were buying skids and skids of things at a time. They sat in a YMCA basement under lock and key, and then they had to get out to the field and folks had to submit their orders to a child care center and then go and pick up. So it was a very, very different way for us to work around supplies. Another critical factor that made us successful was the relationships that we have with our current vendors. And so David and his team have set up a very rigorous system of vetting vendors through an RFP or an RFQ system. And so we end up with the people who are the best fit for the values of our organization and who are willing to work through problems and work with us. And so we were very lucky to have those types of relationships. We, again, some vendors we meet with monthly, with David's team also on board, and sometimes it's quarterly depending on the type of relationship. But that is such a great system, because what we don't want is 3,000 employees calling a vendor and trying to problem solve and deal with issues. Like, they just didn't need all those people calling them asking for a dozen masks. It wasn't going to work. One example that we had about good relationships. So currently, because of the size, we work with 3 caterers. So we had a caterer that we were sort of testing out, and they had a very few number of our centers, but they were the only ones that could quickly get on board and provide catering for the 14 emergency centers that we brought on board. So only 2 of those centers were within their current contract, but they were so flexible and willing to help us, and they just went over the top to make a really great service and a great experience, including adding additional meals like dinner and bedtime snack and all those sorts of things. So it was because of that relationship that we cultivated between vendors, procurement, and program that I think made it such a success. David, we'll give it back to you.
Thanks, Carrie. And I'm, I think that's great backdrop for talking about our preferred vendors. And so I'm going to go through these next few slides fairly quickly, because really I was going to use it as I'm just watching our time, but I'm just going to use it as a way to reinforce a message you probably, well, if you paid any attention to some of the ONN's previous materials on purchasing and ever heard anything from us, we're big believers in a preferred vendor strategy, and that's really that second area of partnerships that I was going to talk about, the partnerships with vendors that had already been selected in the past, that were well vetted. Having a preferred vendor strategy as a foundation made so much of this so much easier, as Carrie mentioned. It gave us some confidence in who we were dealing with. It allowed us to adjust up and down some of the requirements I mentioned, cleaning, HVAC. Some people needed to reduce how often your HVAC filters were changed. Others were increasing for air purification reasons. So making all those changes so much easier, having the ability to get supplies most of the time. I mean, one great example is Staples, one of our preferred vendors. We actually have weekly calls with Staples and their PPE, national PPE manager, to have some visibility into their PPE inventory. It just gives you that level of comfort that they're going to have what you need. You just don't get that kind of coordination with when you're doing you've got a shopping around strategy. Plus, you've just got a sense of comfort. I mean, there were so many suppliers popping up. The pop-up suppliers, there were literally people selling masks out of the back of a van, and they were selling them because people needed them. But this notion of, or the foundation of working with suppliers that you already knew so well, and could trust their legitimacy as a company, the quality of the products they were providing, that they would be compliant with the standards you needed, and of course the pricing. That you knew that they had a long-term vision in working with you, that they weren't going to gain by participating in some of the price gouging that was out there. So, many benefits to working with our preferred suppliers, and I think that's something we'll always stand by. However, this was special time, and special, desperate times call for different measures sometimes, and we had to recognize that we couldn't rely solely on our supplier partners, the ones that we knew so well. That this was a time of changing strategies a little bit, and so our pivot included things like casting the net wider and looking more broadly for suppliers who could provide what we needed. We couldn't afford the luxury of knowing as much as we'd like to know about all the suppliers, because we simply needed to get supplies that staff needed to do their work. So that created all kinds of different challenges. Certainly, as I mentioned, the minimum order quantities, the need to take additional quantities we weren't used to, the lack of ability to deliver directly. Again, we had to do that inventory storage. Those were all some of the side effects of working with new companies, in some cases having to pay up front because suppliers were not taking the risk of putting things on account and getting invoiced for. We certainly weren't used to that. There was the documentation that protected us, that sat behind the supplier relationship, like a contract, knowing that you had their insurance requirements covered. Those were things that you didn't necessarily have the luxury, but we had to develop tools to protect us. So some simple clauses in a purchase order, for example, that covered us against some of the basic risks. Making sure that we did at least some bare minimum research, if we could, on the background of the company to make sure that they were legitimate before we jumped into purchasing with them. And that really speaks to, we didn't want to give up on, no matter how desperate we got, we were not going to give on some key principles, some core principles of those. We did not want to sacrifice quality. We certainly didn't want to get any supplies that were below standards or non-compliant with the standards that staff were required to meet. Look, we couldn't resist the toilet tissues up there, because one of our principles was we didn't want to be participating in hoarding. If we could find supply, we didn't want to take on more than we needed, because that kind of behavior was what was driving some of the chaos that was out there. So we had a principle that we just weren't just going to take more than we needed, and it wasn't going to be at all costs. We weren't prepared to blow budgets, and frankly support the price gouging. If we saw evidence of price gouging, we just looked harder, and we looked until we found what we needed at a fair price, because there were just too many suppliers trying to take advantage of the situation, and we didn't want to be a part of that. So, all of this again required a different set of strategies than we were normally used to. I'm going to hand it back to Carrie one more time.
Thank you. So some of the positive outcomes that have happened during the last 8 months. One was, I mentioned already, is this of launching our virtual programming and being able to communicate out to our communities basically overnight instead of over 5 years. What was a big outcome and a big positive outcome for us. So that was very exciting. Although we were dealing with lots of fear and apprehension from our staff, what we knew was that childcare was already very, very well positioned to take on all these healthcare guidance documents that were coming out. We already did all this stuff. We cleaned, we disinfected, we washed hands, we covered our sneezes and our coughs, we dealt with ill children, we monitored them for illness. So it just was basically ramping it up a little bit. We used to do a daily observation of children when we arrived for signs of ill health. Well, we just added questions and we said them out loud, what we were thinking in our heads. So once our staff understood that, their confidence level shot through the roof, and they quickly got into their new routine. So that was a great outcome. And we maintained a tremendous amount of our staff. We had very, very few staff drop off or resign because of fear, apprehension. Some have stayed off on various medical leaves, but because they have to look after other people. Our enrollment in before and after school programs, unfortunately, has taken a tremendous hit, and it certainly has been affected by the ability to do virtual school. And we noticed that as due dates that school boards set for folks to change their mind hit, then that affects our enrollment. So we opened all but 2 of our before and after school programs, but our enrollment, especially in the, we call it the 905 and the 416, so around City of Toronto proper, is low and an ongoing concern. Our childcare centers for children 0 to 3.8 are vibrant and quite full and are doing very, very well. And children are healthy, and we're having very, very few incidents of illness. And nothing linked. So that's a really positive thing. Another positive outcome was the funding that has been flowed to us. So the Canadian Emergency Wage Subsidy was some people call it CHOOSE, was for charitable organizations specifically. That certainly helped us with salaries and maintaining jobs, because we've invested so much in a very fantastic staff team, and we wanted to do everything to keep them on. So that's helped. And other types of funds too have been available to us through municipal funders for all the items that David and his team have secured for us. So that's certainly been helpful to keep us afloat. David, I'll let you finish it off.
Thanks, Carrie. And we'll just wrap up with a couple of more, and then should have some time for questions if there are any. I guess I just wanted to sum up on a couple of slides, just so you walked away with hopefully the key points. You know, that in the face of all the challenges that everybody was up against, procurement was not immune to it. In fact, was as much front and center as anything else in some cases. But just again, to review, some of the strategies that we found important to us were centered around partnerships, especially one, the ability to have subject matter experts and be tied to people like Carrie, her team, other people who were on top of the changing requirements. We couldn't have done it without that. So really, again, emphasizing understanding your requirements, having good relationships with those groups, number one. Number two, the ability to communicate with your suppliers. That should be something that continues on. They are an important stakeholder group, just like other groups that you were probably working with to communicate as operations change. Can't forget about the supplier community. The ability to work with those suppliers and hopefully preferred suppliers. So suppliers you had good relationships going into this with, made it so much easier to then work with them to adapt on the fly. In some cases, implementing new systems, like I said, inventory, distribution. I forgot to mention something Carrie and I talked about earlier, so important, was the tracking. New systems for tracking all of your supplies, all your costs, whether it was in the WISE case, we had to report to the government because they were trying to collect a sense of what PPE was out there. In other cases, it was simply for funding reconciliation. So developing systems to track and frankly, leaning on your suppliers to help provide some of that data was critical. But then when you can't rely on your preferred suppliers, the ability to cast the net wide and look for other sources of supply without sacrificing some of the key things behind the scenes that stay true to your values. You know, you want to make sure that you're staying true to who you are and protecting your risk and protecting budgets and costs. And then really the last thing I wanted to say was the two things that we found were key components to this, to surviving through this whole thing. And I think you could hear this from what I'm describing and from Carrie's story as well. But one, having the ability to have some access to resources, whether it's in-house or through some partnerships you've got to somebody who knows procurement or is focused on this kind of work. It was a reminder of something we've preached for a long time, and that is procurement is very much a standalone profession like HR and finance and IT. It's not always as front and center as it has been, but it certainly was in recent months. And you know, the ability to draw on some expertise is something that if you've got the ability to do that, then I encourage you to reach out for that help. The other, and I can't emphasize this enough because it's frankly why we're all here, is the notion of collaboration. It was such a strong component to what allowed us to survive through this, was being able to collaborate with other organizations, with other groups. At the Y, I was part of a national committee of YMCAs that got together quickly to navigate through this difficult time. The ONN is the best example. You know, it's all about collaboration. It's one of the reasons we created the ONN purchasing program. We are so much stronger together than we are individually. And especially during tough times, the ability to have a louder voice as a group just meant that suppliers were frankly forced to listen and work with us, that we could minimize the impact of increasing costs. We could impose our values and principles into the situation because we had that louder voice. And you know, this is why the ONN purchasing program, you know, collaborative models like this are so great for the sector, because we are so much better together, even through normal times, but certainly through tough times. And the past few months was just another reminder of that. And with that, I'll wrap it up and turn it back over to Melanie and see if there are any questions.
Wonderful, thank you so much. So if anyone does have other questions, please feel free to type them in the chat box or in the question box. And I do have a couple that we'd like to ask you. So this is open to both of you, but one of the things that you both mentioned, you really emphasized the importance of ongoing communications and having these really strong relationships. And you referenced to meeting once a week with the suppliers. But a lot of nonprofits do not have the capacity to do that. Maybe it's because they're smaller, maybe it's because they've had layoffs during the pandemic. So what would be your advice to someone who maybe doesn't have the expertise for procurement in-house, and they also don't have the time to dedicate maybe a weekly meeting towards it? What's something that they could take advantage of instead?
I can't resist jumping in here and giving a plug to our purchasing program, Melanie. I mean, that's kind of why we created the ONN-PP, the ONN purchasing program, because it's true. Not all nonprofit organizations have access to that kind of capacity, whether it's time, money, support. We try to do that on behalf of all the suppliers or all the participants in the ONN-PP and with working with all those suppliers. Outside of that, you know, I think it doesn't have to be weekly. Setting up regular communications with your key suppliers, and maybe that's the trick, is identifying, okay, it might not be 20 key suppliers, but what are your 2 or 3 that you think it's worth meeting with on a regular basis, even if it's quarterly, and then readjusting the frequency as you hit crisis points like we did. But having the open dialogue, at least the ability to communicate set up so that when you need to, that would be the bare minimum. I don't know, Carrie, if you'd add anything there.
Yeah, that's absolutely it. So for long established relationships that are working well, we only meet quarterly or twice a year. So staples if there's not something specific, if we need something, we just call that day, but we always just make a point of sitting down 2 to 3 times a year. For a newer vendor or one that maybe is not meeting our needs, we meet with them a little bit more frequently, and we just keep a date on the calendar to touch base and to make sure that they're on track with meeting the standards that we want them to make sure they've done the things that they said that they were going to do. And then that week thing was really specific to the pandemic. We wouldn't typically meet with a vendor that frequently, or our 2 teams don't meet that frequently. We meet everywhere from a month to, you know, quarterly, depending on what's going on, but that was specific to this period of time.
Okay, wonderful. And I'm just being cognizant of time, so I think we have time for one more question. And so to leave off kind of for a final question, you know, I think one of the things this year has taught us, especially regarding procurement, is that we may need to adapt a lot faster than we traditionally would. So maybe we normally have time for an RFP process and now we don't. And so your preferred vendors are obviously a really great example of how you can curtail that by working with an O&M purchasing program, or how you guys have your own YMCA programs. But for people who are on this call right now and who maybe right now they don't have an urgent need for PPE or something particular, but they want to be prepared for the next wave, whatever it might be of urgent needs, what's one step they can take today so that way when a crisis does come, they feel better prepared to handle those procurement challenges?
I'll jump in again, Carrie. I can't help but again say these, whether it's the ONNPP or something similar, because there are other programs out there. But you know, trying to build something on your own, if you're smaller, is not necessarily the best way to go. There are things that are developed already that you can take advantage of. My caution there would be back to making sure you understand your requirements. It can't be just anything that was built for anybody. So, you know, you want to align with a group or some pre-developed solution that was developed at least somewhat with your needs in mind. And that's what we've tried to do with the ONNPP for the nonprofit sector. But again, there are others. But yeah, you don't need to reinvent the wheel. There are a lot of wheels out there, and hopefully you can take advantage of one of them. But here we are, ONNPP. This is it. This is why we created it. Carrie, anything to add?
Yeah, I think it's just these networking opportunities that are the key. David mentioned that he was part of a national strategy for YMCAs across Canada. I was on a provincial group specific to childcare, and so it's those networking with organizations that are similar to yours and sharing those ideas and resources is the best way to go.
Wonderful. Well, thank you, David, and thank you, Carrie, for sharing your time and expertise today. We really appreciate having you on this webinar. And thank you, everyone who also joined the webinar today. We would love to stay connected with you, whether it's you following us on social media, maybe you're joining a future webinar, or staying connected through our monthly newsletter. Please feel free to reach out to our team at any time. We hope you all have a great day, and thank you again for joining.
Thanks, everyone. Thanks, Melanie.
Thank you.